After more than 3 decades working in hospitals, rehabilitation units, and recovery wards, I've noticed something most people only discover when it's already a problem. The moment older adults begin losing strength rarely happens during activity. It often starts long before they even stand up in the morning. I've watched people who were independent for decades suddenly begin struggling with balance, stiffness, and weakness. And when we look closely at what changed, it usually wasn't just aging. It was how their bodies were starting the day. Many patients told me the same thing. "Doctor, I stretch every morning," and stretching does help. But here's what most people don't realize. Stretching makes muscles longer. It doesn't necessarily switch them on. Activation is different. Activation wakes muscles up so they stabilize joints, support circulation, and prepare the nervous system for coordinated movement. Without that activation, the first steps of the day happen with cold muscles, slower responses, and less support around the joints. And that's when instability and injuries quietly become more likely. In mobility recovery programs, seniors who performed simple activation movements before getting out of bed consistently showed better coordination and stronger responses in their lower body compared to those who relied on stretching alone. These are not intense workouts. They are controlled movements done in bed that gently wake up the body, improve circulation, and reconnect communication between the brain and muscles before you put weight on your feet. But here's the interesting part. One specific movement kept standing out again and again when researchers reviewed mobility outcomes. It consistently produced stronger lower body engagement and better stability responses than the others. That exercise holds the #1 spot in today's ranking, and the reason behind it may surprise you. In this video, we'll walk through 5 bed exercises ranked from the least impactful to the most powerful. And stay with me until number 2, because that one could dramatically change how steady you feel when standing up in the morning. Before we begin, I'm curious. How old are you today, and what country are you watching from? I read the comments and genuinely enjoy hearing where everyone is tuning in from. Now let's start with number 5, a movement many people underestimate that prepares your body for the very first step of the day. Number 5 is ankle pumps and circles. This exercise might seem almost too simple to matter, but don't underestimate it. In fact, orthopedic surgeons prescribe ankle pumps to almost every patient recovering from hip or knee replacement surgery. And there's a very specific medical reason why. When you lie in bed for long periods, blood naturally pools in your lower legs. Your calf muscles normally act like a secondary pump for your circulation. But when they're inactive, blood flow slows down. And this is where things get interesting. Research published in the journal Thrombosis Research found that adults over 75 who stayed in bed more than 8 hours without activating their lower legs had a dramatically higher risk of developing deep vein thrombosis, also known as DVT. That's a blood clot that can travel to the lungs and become life-threatening. Ankle pumps help prevent this by activating the calf muscles and pushing blood back toward the heart. Here's how to do them correctly. Lie flat on your back with your legs extended. If it feels more comfortable, place a small pillow under your knees. Point your toes down toward the foot of the bed as far as possible. Hold that position for 2 seconds. Then pull your toes back toward your shins and hold again for 2 seconds. That counts as 1 pump. Perform 10 pumps in a row. After that, slowly rotate your ankles in circles. Do 10 circles clockwise and then 10 counterclockwise. The secret to making this effective is slowing down. Most people rush through ankle pumps and barely move their feet. But when you move slowly and use the full range of motion, you activate not only the major calf muscles, but also the small stabilizing muscles around your ankle. And those muscles are extremely important. Studies from orthopedic research groups show these stabilizers contribute heavily to balance control when standing. And they're often among the first muscles to weaken later in life. Try performing 3 sets of ankle pumps and circles every morning before getting out of bed. It's a simple way to support both circulation and balance from the moment your day begins. Now let's move to number 4, where we begin protecting the joints themselves. Number 4 is heel slides. If your knees feel stiff in the morning, ache when you move, or make those uncomfortable cracking sounds, this exercise can make a noticeable difference. Heel slides are one of the safest ways to maintain knee mobility because your body weight isn't pressing down on the joint. That's important because osteoarthritis affects millions of Americans, especially later in life. The reason this exercise works so well is that your knee moves through its natural range of motion while the leg stays fully supported by the bed. That means gravity isn't compressing the joint and the bones aren't grinding together. A study in the Journal of Orthopedic and Sports Physical Therapy followed adults over 70 who practiced heel slides daily for 12 weeks. Participants improved knee function significantly and reported much less pain during everyday activities like walking and climbing stairs. Here's how to perform them correctly. Lie on your back with both legs extended. Slowly bend your right knee by sliding your heel along the mattress toward your body. Keep the heel in contact with the bed the entire time. Slide it as far as comfortable without forcing the movement. Hold the bent position for 3 seconds, then slowly slide the leg back out to the starting position. The slow return is extremely important because that's where your quadriceps muscles build strength while lengthening. Aim for 12 repetitions on each leg and complete 2 sets. If you want to make the movement smoother, place a plastic bag or pillowcase under your heel so it glides more easily. One small detail that makes a big difference is keeping your kneecap pointing straight up toward the ceiling. If the knee rolls inward or outward, uneven stress develops inside the joint. Over time, that uneven loading can accelerate joint wear. Keeping the knee aligned helps distribute pressure evenly and trains your body to move in a safer pattern. There's another benefit many people don't realize. Inside your knee joint is a fluid called synovial fluid. It acts as a natural lubricant and shock absorber. But here's the surprising part. That fluid only circulates properly when the joint moves. If your knees stay still all night, the fluid becomes thicker, which is why your knees often feel stiff when you wake up. Heel slides gently pump fresh fluid through the joint, warming it up and reducing that grinding stiffness people often blame on aging. But it doesn't have to be that way. And now we move to number 3, where things start improving core strength and hip stability. Number 3 is supine marching. This movement may look simple, but it targets muscles that many older adults rarely train directly. And when those muscles weaken, walking becomes much more difficult. Supine marching strengthens the hip flexors, deep core stabilizers, and lower abdominal muscles. Why does that matter so much? Because a major study published in the Journal of the American Geriatric Society followed more than 2,000 adults over 75. The researchers found that weakness in the hip flexors was one of the strongest predictors of future falls, even stronger than general leg strength. These muscles are responsible for lifting your legs when you walk. When they weaken, your steps become shorter and you begin shuffling. And once that shuffling pattern starts, even a small obstacle on the floor can become a tripping hazard. Here's how to perform the movement. Lie on your back with your knees bent and your feet flat on the bed. Place your hands gently on your lower abdomen so you can feel your core muscles working. Slowly lift your right knee toward your chest while keeping your lower back pressed against the mattress. This detail is crucial. If your lower back arches up while lifting the leg, the movement shifts strain toward the spine instead of activating the core. Hold your knee at the top for 2 seconds, then slowly lower it back down. Repeat the same movement with the other leg. That counts as 1 repetition. Work your way up to 15 repetitions per side for 2 sets. Focus especially on lowering the legs slowly, because that's when the core muscles activate the most. Research from the University of Pittsburgh found that seniors performing controlled hip flexion exercises for 8 weeks improved walking speed significantly and reduced their fall risk by nearly 40%. That kind of improvement translates into real-life independence. Things like crossing the street safely or catching yourself before a stumble becomes a fall. Now we're approaching number 2, and this exercise builds the type of leg strength that protects your mobility long-term. Number 2 is straight leg raises. If there is one muscle group doctors focus on preserving after 70, it's the quadriceps. These large muscles on the front of your thighs straighten the knee, support your weight when standing, and control your body when sitting down or going downstairs. But here's the reality most people don't hear. After age 70, quadriceps strength can decline 3 to 5% every year without regular activation. And this is where things get concerning. Clinical research has shown that adults with weak quadriceps are far more likely to need help with daily tasks and significantly more likely to require mobility aids within just a few years. Straight leg raises are one of the safest ways to strengthen these muscles without placing pressure on the knee joint. That's why they're a cornerstone of orthopedic rehabilitation programs worldwide. Here's how to perform them correctly. Lie on your back with one knee bent and the foot flat on the bed. Keep the other leg extended straight. Tighten the thigh muscle of the straight leg by pressing the back of your knee gently into the mattress. Then slowly lift that leg upward while keeping it completely straight until it reaches about a 45-degree angle. Hold the position for 3 to 5 seconds. You should feel the muscles on the front of your thigh working. Then slowly lower the leg back down over about 3 seconds. Don't let it drop. The slow lowering phase is where the muscle gains the most strength. Perform 10 repetitions on each side for 3 sets, resting about 30 seconds between sets. As you grow stronger, you can increase the hold time or add a light ankle weight. Gradually increasing the challenge is important because muscles adapt quickly. Without progression, even effective exercises eventually stop producing results. Now we arrive at number 1. The movement many specialists consider the most important bed exercise for maintaining independence later in life. Number 1 is the glute bridge. Physical therapists, orthopedic surgeons, and mobility specialists all agree on one thing. If you could only perform one exercise in bed each day, this might be the one. The glute bridge activates what's called the posterior chain. That includes your glutes, hamstrings, lower back muscles, and deep spinal stabilizers. And those muscles play a huge role in posture, balance, and walking strength. Large clinical studies have shown that weakness along the backside of the body is one of the biggest risk factors for falls and loss of independent mobility. When these muscles weaken, posture begins to collapse forward, balance shifts, and the body gradually loses its natural stability. But here's something many people don't realize. The glute muscles often become inactive over time, simply from too much sitting. Researchers sometimes call this gluteal amnesia, where the brain gradually forgets how to activate the glutes efficiently. Glute bridges help wake those muscles back up. Here's how to perform the movement properly. Lie on your back with your knees bent and your feet flat on the bed about hip-width apart. Your heels should be close enough that you can almost touch them with your fingertips. Before lifting your hips, squeeze your glutes tightly. This step is critical because it ensures the correct muscles activate first. Then press through your heels and slowly raise your hips toward the ceiling until your body forms a straight line from shoulders to knees. Hold the position for 5 seconds while breathing normally. Then lower your hips slowly over 4 seconds and immediately lift again without resting. Keeping the muscles under continuous tension increases activation significantly. Start with 10 repetitions for 3 sets and rest about 45 seconds between sets. As your strength improves, you can progress by lifting one foot slightly off the bed during the bridge or squeezing a pillow between your knees to activate the inner thighs. Consistent practice of glute bridges can produce remarkable results. Long-term research has shown significant improvements in walking endurance, balance, and overall mobility in older adults who perform this movement regularly. And that can make the difference between remaining independent and gradually losing mobility. So there you have it, 5 bed exercises that help activate the body far more effectively than stretching alone. Stretching certainly has its place, but flexibility alone doesn't build the strength and stability your body needs to stay mobile. These 5 movements support circulation, joint mobility, core stability, leg strength, and the powerful muscles that keep you upright and confident when walking. The entire routine takes less than 15 minutes and requires no equipment at all. You can perform it on any mattress in your own home. Start with the exercises that feel easiest for you and gradually increase the repetitions over time. Even if you begin with just a few repetitions, that's perfectly fine. What matters most is consistency. Within a few weeks, you may notice getting out of bed feels easier, walking feels steadier, and everyday tasks require less effort. Your body adapts faster than you might expect. And every repetition you perform today is an investment in your independence tomorrow. If you found this information helpful, subscribe to the channel so you don't miss more simple strategies that help you stay strong, mobile, and independent as you age.